Friedman, right, who will talk to us about racism and mass incarceration in the wake of COVID-19 and its afterlives. So I know that you all have choices about where you can be and how you can spend your time. So I really thank you for choosing to be with us tonight. And I'm really excited about our speaker and our conversation tonight. So before we get to what you are all here for, to listen to Dr. Friedman, I just want to take some time to thank the folks who made this event possible, and also to say a bit about the work of our co-sponsor, PSU's Higher Education in Prison program. Also, as we kind of get rolling here, just a reminder, this is a webinar format, so you can see us, but we can't see you. And so please, I invite you just to sit back and relax. So first, just big thanks to all of the behind the scenes work of Christina Rojas in the class dean's office. Thanks to Bahar Jabari in sociology, Suzanne Van Amberg in Judaic Studies, Deb Arthur in University Studies, and also big thanks to all the sociology faculty and grad students who helped brainstorm for this event and who helped us come to the conclusion that we should invite Dr. Friedman to talk with us tonight. And of course, thanks so much to Brittany Friedman for being willing to share her time, her insight, and her research with us tonight. So of course, I want to say a few words about who I see as the person responsible for making this event possible, and that's Bob Liebman. I'll first say that Bob wasn't particularly keen about us naming this event after him, but I think mostly that's because he's a pretty humble person and he feels like he's had enough accolades thrown at him recently. But for those of you who don't know, Bob was a faculty member in sociology for 31 years, recently retired in 2018. And during his career, he made significant contributions, more than I have time to list, especially to his home department in sociology, but also to Judaic Studies, Faculty Senate, AAUP, et cetera, and also to the larger PSU community. And he's still making contributions, as you can see. But more relevant to this talk, it was a few years ago that Bob approached me with an idea, kind of a vision for an annual event, a lecture of some sort. And I think key to this vision, at least this is kind of my interpretation from talking to Bob, was the importance of bringing people together, bringing together a diverse group of folks from across campus, from across the larger community, and perhaps even beyond our local community, to engage in some spirited and lively discussion about relevant topics that are inherently sociological. I think one of the things Bob most loves to do is to have conversations about sociology. And I think he sees this, and I think we see this as one way to help build connections and community, to provoke some conversation, and perhaps create some collaborative action around social justice issues that are important to us, including issues such as systemic racism and mass incarceration and the unequal health outcomes associated with COVID. So we'll have some time for reflection and some Q&A after the talk. So you might start thinking about some of your questions. You should see a Q&A box at the bottom of your screen that you can post questions in that we will get to after the talk. But I also hope that any of the ideas and conversation that happens here doesn't stop here. That some of these conversations and ideas and insights kind of spill over into conversations we have with friends and family, colleagues, students, today and tomorrow, and beyond that. Perhaps these conversations can spark some ideas for change, collective action, and a greater sense of community. So again, I just really want to thank Bob for his legacy and what he's left us in the department, and for his continued work in our department, and for continuing to inspire us. So this is actually something we'd like to start as a new annual tradition in sociology. But I think for that to happen, we're going to need some help. So if you're here from a PSU department or program, or from a community organization, and you have ideas for collaborating on events in the future, I'd love to have a conversation. So please feel free to reach out. I'm actually going to ask Bahar if she could just post the link to the sociology website in the chat, where you can find out what's happening in sociology and our contact info. And of course, if anyone's interested in financially supporting this event as we go forward, more than welcome, of course. So We'll also put a link to our giving page in the chat. So before we introduce tonight's speaker, I want to say more about our co-sponsor, Portland's Higher Education in Prison program. And one of the reasons we wanted to do this is that because I think co-sponsoring with a program such as the Higher Education in Prison program really also speaks to and embodies the vision of this event. So for those of you who don't know, PSU's Higher Education in Prison program, it's a relatively new program. It has a mission to provide opportunities for students at Coffee Creek Correctional Facility in Wilsonville to work toward a PSU degree while experiencing incarceration, and to be able to quickly and easily transition to the PSU campus upon release. So the Higher Education in Prison program was co-founded in spring of 2018. So again, this is a relatively new program, co-founded by Deb Arthur, who is faculty in university studies, along with a formerly incarcerated graduate student in Portland State's Masters of Social Work program. So the first PSU class at Coffee Creek was in fall of 2019, had 20 students. And since then, PSU has offered 18 courses and enrolled over 75 students at Coffee Creek. So in my opinion, that's a pretty fantastic growth in a short amount of time during a pandemic. So I think I'm kind of continually amazed to learn about the work of the Higher Education in Prison program. And I just wanted to use this opportunity to bring it to others' attention, to really spotlight the work that they're doing. So if you're interested, if this work speaks to you, I encourage you to check out their program through their website. I think Bahar is also going to put a link to their website. And also, if you're interested in contributing, consider making a donation. There's a link to their giving page as well. And any donations help expand their programming, which is primarily dependent on soft money, grant money, and foundation money. So donations help expand their programming and to pay tuition for individuals incarcerated at Coffee Creek who are working towards a degree at Portland State. So I wanted, at this point, I wanted to just introduce Matt Carlson. So many of you probably know Matt. First and foremost, a sociologist. Currently is associate dean in the College of Liberal Arts and Sciences. And Matt asked if he could say a few additional words about programs such as HEP and the impact that they have on our students and in our community. So Matt, I'll hand it over to you.
Thank you so much, Lindsay. It's always wonderful to come back to, excuse me, sociology events like this. It feels like coming home. I'd like to just say a few words of thanks. I know, Lindsay, I appreciate all the work that the department and puts into having events like this, which are so critical for the mission of the college, and I know the department too. I would like also to thank Professor Liebman for his years of service. It's really wonderful to have opportunities like this to bring our community together. And really, what I'm particularly excited about tonight's event is the way that tonight's topic continues to provide additional examples of the incredible ongoing relevance of sociology and why we need a sociology now more than ever, more than we ever have. And so I'd say, and I want to also thank Brittany for Professor Friedman for coming from beaming in from California. Thank you for being here. And I'm very excited to hear your talk tonight. The couple of things I wanted to say is I really appreciate that we have opportunities like this and to be able to discuss these very timely topics. I can say firsthand, I put a little story about a young man named Ezekiel, who I had the opportunity to provide a bachelor's degree from Portland State, to award the bachelor's degree from Portland State. Deb Arthur does amazing work, and I know is an incredibly dedicated and talented person who has brought so much to these programs around higher education in prisons. And as a sociologist, many of us get into sociology because we really understand that our life chances often are a result of broader social structures. And I think being able to contribute even in a small way to this ongoing work of trying to transform the lives of prison affected youth and adults is really special. So I hope all of you out there get a chance to really look at the program, Higher Education in Prisons, look at the stories, and support the program in some way. With that, since I'm very excited to get to the talk, I'll stop talking now and just again, welcome on behalf of the College of Liberal Arts and Sciences.
Yeah, thanks so much, Matt, for being here and for saying a bit more about sociology and its relevance and the College of Liberal Arts and Sciences and all the great things that are happening, including collaboration with the Higher Education in Prison program. I'm gonna stop yakking now and introduce this evening's speaker, Dr. Brittany Friedman. So Dr. Friedman is an assistant professor of sociology at the University of California and also a faculty affiliate of the Center for Social Innovation and the Equity Research Institute, which is also at the University of Southern California. Dr. Friedman is a sociologist of punishment and social control. She researches race and prison order, inequality, mobilization against the carceral state and the criminal legal system as an economic market. Dr. Friedman is co-PI of a comparative study of inmate reimbursement practices, also known as pay to stay. She's a 2021-2022 American Bar Foundation, JPB Foundation Access to Justice faculty scholar, where she's examining the relationship between legal representation, pay to stay, and civil recruitment strategies. And she's also the PI of an ongoing study of COVID-19 penal policy, which traces how formal and informal practices affect the conditions of confinement in prison. So we're so lucky to have Dr. Friedman with us tonight, who will discuss the social factors that make prisons natural epicenters for COVID-19 and the implications for Black communities in the wake of COVID-19. So I'm going to turn it over to Dr. Friedman. Thanks so much for being here.
Thank you so much, Lindsay, for that introduction. And I just want to say first that it is such a joy to be here. I am so honored to be able to give the inaugural lecture and just to celebrate your department and the Higher Education in Prison program. This is so wonderful, and I really appreciate everyone showing up to hear me speak today. I'm just going to share my screen. So as I decided how to go about speaking this evening, I really wanted to center first and foremost how institutions are really central to outcomes, particularly in the wake of disasters such as COVID-19. I think if we all look back to the year 2020, to the time leading up to it, so bringing us back and thinking about as a collective, when we were entering that year, when we were just coming out of 2019, the truth is that all of us didn't really know what was to come. We celebrated the new year, we embarked on setting our resolutions and intentions and expressing gratitude for those that we hold dear. But as we know, and as we have lived and survived, in only a short couple of months, the world as we knew it would change forever. And we'd begin to look around and not know if we could make it. Suddenly, if our neighbors, our families, if our friends or communities could survive what had come and what would be coming. And I like to think of it as, at that time when I placed myself there, we were all holding our own hearts in our hands, our heads in our laps, as the jurisdictions around us at the local, state, and federal levels scrambled to recognize the novel coronavirus and the COVID-19 illness it causes as an emergency, one that would bring our society, our institutions, and communities to the brink of disaster. In March 2020, many states began to declare what we would consider states of emergency, particularly in regions that began to experience rapid increases in cases. This was the case for New York and New Jersey in the tri-state area. And on March 9th, 2020, for example, Governor Phil Murphy in New Jersey did just that.
So some new developments in New Jersey. The governor has just declared a public health state of emergency in the Garden State. This comes after the number of COVID-19 coronavirus cases in New Jersey has nearly doubled, with officials announcing 5 new infections today. Eyewitness News reporter Cleve Bryan is live at the New Jersey Regional Operations and Intelligence Center, where a press conference was held earlier this afternoon. Cleve, what's the latest?
Natasha, just 5 minutes before 6 o'clock, the governor issued that emergency declaration for all 21 counties in New Jersey. This essentially frees up resources that may be able to flow through the state, through state agencies to affected communities. This, as just earlier this afternoon, officials were warning the people of New Jersey to be prepared for possible exposure as the coronavirus continues to spread. Describing the largest daily jump in COVID.
And so, as we know from looking back in time, disaster didn't strike everyone in our country the same. And not everyone benefited from this new flow of resources, limited resources from federal agencies after these declarations of emergency. Your skin color, who you choose to love, where you live, your access to preventative care, where you work, where you're from, and how many generations you've lived, all stacked the decks against many. And our institutions let the cards fall where they may, to the detriment of all of us. And as a series of lockdowns rolled out across regions of the country, those locked away in our jails, prisons, and immigrant detention centers sat waiting for the inevitable day that an officer or a staff member would cough, signaling that COVID-19 had now reached their cages. And I quote, "There's no way out," they thought. "The day has come. The only thing we can do is hope, pray, and wish that someone out there still cares about us in here." For example, in New Jersey, nursing homes were hit the hardest, followed by the state prison system. New Jersey prisons experienced a surge in infections and death in March and April of 2020, with the Marshall Project asserting in July 2020 that they had the highest death rate and the second highest infection rate. The fact that incarcerated people were far more likely to get sick and to die from COVID-19 than other New Jersey residents would soon be the pattern for other states struggling to stop the spread within free and confined society. And amidst this March and April surge, when the coronavirus arrived at Edna Mahan Correctional Facility for Women in New Jersey, a woman, an incarcerated woman there named Tiffany Mofield, wouldn't have long before she would contract COVID-19. And so Tiffany, she was a mother, she was a daughter, she was a friend. And like everyone's family at the time, Tiffany's family had no idea that their loved one had been sentenced to a death sentence when she entered prison 4 years prior. By the time Tiffany passed away alone, ignored in solitary confinement. She was one of 37 people to have died at the time after contracting COVID-19 in New Jersey prisons. The New Jersey state prison system was one of the deadliest places to be during the first wave of the pandemic. When learning of her mother's death, Tiffany's daughter wrote, and I'm quoting, she wrote, "I wanted you home, but not like this. I waited almost 4 years for that woman to get back out here with me. I couldn't wait to wake up to her cooking breakfast," end quote. At age 43, Tiffany left behind 2 parents, 3 children, and 4 grandchildren. In the time leading up to her death, Tiffany spent 2 weeks in the prison infirmary in the first half of April of 2020. But despite still having clear, persistent symptoms of COVID-19, she was discharged by prison medical staff and sent to quarantine and solitary confinement, also known by its euphemism, administrative segregation. And this is something that in our ongoing study has emerged as a pattern with people that we have interviewed who survived the prison system during this time. And so on April 29th of 2020, Tiffany was taking a shower and the typical restraints put on women in solitary confinement. So that means she was forced to wear a metal belly belt and handcuffs despite her persistent trouble breathing, and she was forced to take a shower with the door locked, which is also routine practice. And not soon after she began showering, Tiffany started to panic because she could not breathe. Another incarcerated woman named Angelina, held in solitary a few doors down, saw Tiffany panting, hands on the door, and crying out for help, begging with the words, "I can't breathe. Someone, please open the door." As Tiffany hit the door with her last bits of strength, no one came. She hit the door once more and no one came. Gasping and mustering up as much strength as possible to cry out one more time, but no one came. Angelina watched in horror as Tiffany took her last breaths on the floor of the locked shower, held in chains and cuffs, signaling to all that witnessed her die that Tiffany wasn't a human at all to this place. She wasn't a mother, she wasn't a daughter, she wasn't a friend, but instead she was just another Black woman, a number, a criminal that had been thrown away. And that's how the institutions and its representatives let her die. Tiffany was unresponsive by the time staff finally came, and she was pronounced dead before any ambulance ever arrived. As Angelina put it, I'm quoting, "She died right in front of my neighbor's door, just diagonally from my door, about 5 feet away. Many inmates are frightened for our lives and safety as a result of us witnessing Miss Mofield die." But Tiffany's family was determined to remember their loved one and show the world her humanity, trying to restore in her memory what the prison had taken away. Her family continued to call prison officials, demanding information about Tiffany's death, with her father recounting painfully that when he called repeatedly about his daughter, quote, "They put me on hold and then hang up," end quote. What's important to understand sociologically is that how Tiffany was treated was common. It was common routine practice at the time, both in New Jersey state prisons and within penal institutions around the country, attempting to cope with the pandemic as disaster. In particular, Societal institutions writ large mishandled the pandemic in ways that disproportionately harmed and continue to harm minoritized communities, particularly Black communities. The rapid transmission of COVID-19 is a disaster for Black communities and is further exacerbated by the longstanding consequences of mass Black incarceration. What I mean by disaster is an event causing shock to a community through severe losses to people, property, and resources, such that the resources within the community are significantly compromised. If we go and we believe that definition, then we can argue that Black communities have survived in the wake and afterlife of disaster for generations. From chattel slavery to convict leasing to contemporary mass incarceration to Hurricane Katrina and the Flint water crisis, Black communities continue in the wake and afterlife. It is from within this context that Black communities experience the prolonged shock caused by COVID-19. And formal institutions of social control exacerbate the socioeconomic fallout from disasters, chiefly because they perpetuate legalized structural violence. And this brings me to the question that I was wrestling with when I started thinking through everything that I was seeing and experiencing. And at the time, I was in New Jersey at the time. I was at my previous institution, I was at Rutgers. And so I was thinking about the question, what is the relationship between racism, mass incarceration, and COVID-19? And I was thinking about this in May of 2020. And I thought, well, we must first contend with the significant fact that Black people dually contend with histories of state abandonment and state ownership, with the carceral state structuring intergenerational dispossession, most notably in continued disproportionate incarceration. And when it comes to that last point, sociologists Becky Pettit and Brian Sykes, they have a quote that I like, and they contextualize it. They write, "It is important to bear in mind that racial and ethnic disparities in incarceration are not a reflection of trends in crime or victimization. The concentration of incarceration in racial and ethnic minority groups is due to shifts in policing, prosecution, and sentencing that disproportionately affect historically disadvantaged groups. For example, as a result, Black people represent approximately 33% of incarcerated people in state custody and 40% of incarcerated people in federal custody, despite only being 13% or so of the general US population. And with this in mind, then it is quite evident that incarceration and the social organization of penal institutions structures how all Black communities live and die in the wake of COVID-19. And why do I use the word "in the wake"? I chose it not because it's a cool phrase, but because I chose it deliberately. Because one of my favorite Black feminist scholars, theorist Christina Sharp, she wrote an entire book on "In the Wake" on Blackness and being. And she theorizes the wake as a means of understanding how slavery's violences emerge within the contemporary conditions of spatial, legal, psychic, material, and other dimensions of Black non-being, as well as in Black modes of resistance. Living in the wake of slavery is living the afterlife of property. Living in the wake on a global level means living the disastrous time and effects of continued marked migrations here in the United States. It means living and dying through the policies of the first US Black president. It means the gratuitous violence of stop and frisk and Operation Clean Halls, rates of Black incarceration that boggle the mind. For Black communities, I argue living in the wake of the COVID-19 pandemic as a disaster occurs on an intergenerational continuum, facilitated through pre-existing structural violence and historically slow institutional responses, particularly for incarcerated Black people whose experiences have networked consequences for their communities. As a viral pandemic, the rapid transmission of COVID-19 in correctional settings in the year 2020 was an ongoing disaster that increased in severity and consequence over time, over the course of the year, rather than shock communities as a single traumatic incident. For example, only 6 months into the pandemic, on August 14th, 2020, over 95,000 incarcerated people tested positive for COVID-19. Which was a 10% increase from only the week prior. And at the time, the human toll continually grew as the number of cases continued to climb within confined spaces. If we take it back to as early as April, in April 2020, Human Rights Watch issued a public statement warning that the rapid spread of COVID-19 among incarcerated populations in the US was, and I'm quoting, an imminent catastrophe. However, institutional responses to the pandemic were a death sentence, and they were a preventable outcome, I suggest, occurred by institutional design rather than by accident. First, penal institutions prefer to maintain their socioeconomic investment in punishment as a political and cultural enterprise, rather than release high numbers of people, since such releases would imply that these are people that could have been released sooner prior to a disaster. New Jersey, for example, did not start releasing large numbers of people until November 2020, but through December and even into January 2021, after intense pressure by local advocacy groups, starting at least 9 months into the pandemic. What this suggests is that maintaining the prison as a legitimate form of punishment was significantly more important than mass releases, because mass releases are politically and culturally incompatible with a racist national imagination. The commitment to incarceration is also intimately linked to our economic investment in punishment, which I won't go through because I could speak about that one sentence forever, actually. But consequently, this means that a commitment to maintaining the prison as an institution of punishment is the foundation of institutional death by design, which COVID-19 has further exposed, which I will go into more in depth. Evidence from early on in the pandemic also suggested that incarcerated Black people were dying of COVID-19 at higher rates than others, with some dying just before their release date after serving decades in prison. In New York State, for example, 75% of people who died of COVID-19 early on in the pandemic while incarcerated identified as Black, Latinx, or both. As Jose Saldana, who was the director of the Release Aging People in Prison Project, he pointed out at the time, quoting, "For decades, Black and Latinx people have been dying in New York prisons, either from lack of adequate medical care or from the brutality of correction officers and the system as a whole." A disaster response that privileges protecting the prison as an institution rather than saving the lives within also impacted the health of staff, further compounding the health inequities that are wrought by the novel coronavirus. Reports suggested, for example, that correctional officers were consequently transporting the virus home to their communities. And in many communities, they are similarly disproportionately comprised of racial and ethnic minorities. And so given the fact that health inequities in society persist among racial and ethnic minorities because of a structurally violent system, we must also contend with how structural violence conditions the social organization of penal institutions. The criminal justice system and the broader carceral state, they link together racially degrading institutions under the guise of many things, of redemption, of rehabilitation, with corrections often framed as a welfare state provision to some in order to maintain some sort of rehabilitative ideal. Prisons, in fact, are actually a legally considered form of legitimate structural violence. And so because of that, they have magnified levels of harm, with incarcerated people harmed at such levels that scholars theorize institutional deprivations as a form of state crime in certain literatures on the topic. And so as thinking about all of these issues and all of these pieces of the puzzle, I came to the conclusion that a critical analysis of the structural determinants of social organization within penal institutions as for grounding COVID-19 disparities among the incarcerated is crucial, particularly with regard to insights from sociologies of penal institutions. And so there's a rich and vast sociological literature on the social life and organization of life within penal institutions. And this literature has long identified, for example, the role of social identities such as race and class, the significance of deprivations such as the loss of autonomy, institutional classification techniques, and institutional control strategies that are designed to intentionally cause harm, or even in recent works, death, as foundational for the social organization of penal institutions. And so these theories are collectively revealing how they are and were structurally violent prior to the COVID-19 pandemic, meaning that prison life is socially organized to punish incarcerated people through degradation and restricted access to basic human needs, with racial and ethnic minorities historically bearing the brunt of this system. And so this is why when we look at, for example, the tragedy of Tiffany Mofield, it is a tragedy that is not only possible, but is probable if we look at the conditions. And I will speak more to this, but just thinking through some of the interviews that we did with people that were eventually released at the very end of the year, when New Jersey finally began releasing more people, people described and talked about a very strong fear of being disappeared in solitary as a type of quarantine. They talked about banding together and mobilizing to try to take care of each other's basic needs to prevent this from happening, to try to counter the institutional degradation and different types of collective action as well to really try to advocate for themselves up to a point, because there was obviously a tipping point where at times their actions could be seen as not being, for instance, useful to particular penal actors. And what I mean by that is that we did find cases where at times, for example, where the officers union was trying to push for changes in their own conditions, they were more likely to allow incarcerated people to also mobilize because it was seen as useful at the time for their own means. So building from the conceptual work that I've discussed, and also the insights from the sociology of disaster, but also from critical race theory in terms of really centering the intentionality and racism of formal institutions of social control, I suggest that when penal institutions are officially categorizing people as detainees, as inmates, as prisoners, they're doing so in order to deliberately relegate human beings to a degraded social status. And ultimately, this is in service of an intentionally racist system. And so in conceptualizing why prisons are natural epicenters for COVID-19, I came up with and outlined the following institutional parameters as social factors. And so first, I suggested that death is by institutional design, where penal order is arranged so that people categorized as prisoners are in a situation where they are more likely than someone on the outside to die in many ways. And so what I mean by that is to die socially, to die psychically, and physically. The second point that is important is that I realized that promoting institutional survival rather than human survival is second nature during a disaster, because the pre-existing social organization of penal life serves this purpose. And then finally, when a disaster does strike, causing severe loss to people and resources, uncertainty is managed by implementing strategies that are going to magnify the deaths of incarcerated people in exchange for the life of the institution. So in linking these different conceptual frameworks, what I'm trying to do is really provide and produce a foundational critique that is necessary for understanding COVID-19 and all of its racist consequences. Just a note here that I did want to mention is why is critical race theory central to really framing intentionality when we're talking about racism, particularly in terms of COVID-19 and disaster? Well, critical race theory is important because it gives sociologists with the tools to center racist intentionality. As noted by Black feminist Kimberly Crenshaw, she describes how the law is foundational to the maintenance of this structure as a system of domination and intentional subordination. And so in doing this, we can really locate, if we're talking about the rise of Black mass incarceration, we can actually locate it as beginning in the Reconstruction era, and showing how such structural violence was beneficial to all social institutions and protected at all costs. And from this historical positioning, we can understand why would the institution try to save itself? Well, it has tried to save itself many times, and the COVID-19 pandemic is not going to be the first time. It's actually something that we could predict in terms of how the institution would have behaved within this context. So now, using these insights, I'm going to walk us through some of my thoughts on why prisons are natural epicenters in more depth, and how does this relate to racism and the history of mass incarceration. So my first important claim is that death is by institutional design. Mass incarceration, we can think of it as sociologists as a social innovation that permits the recoupment of white capital losses and serves as a hopeful antidote to white rage, disguised as simply the rightful infliction of just punishment. So this would be a critical race theory interpretation of what is mass incarceration actually doing and where is it coming from. In 1865, As many of you might know, the 13th Amendment to the US Constitution formally abolished chattel slavery, yet explicitly legally categorized prisoners as slaves of the state. The 13th Amendment is touted as initiating the first massive expansion of civil rights in the United States, despite maintaining the legitimacy of slavery if enacted as punishment for a crime. And so this clause allowed the swift re-enslavement of Black communities across the United States, most notably in the southern states. The same institutions, same families were profiting from the bondage of Black people turned to convict leasing to recoup their property losses with the abolition of chattel slavery. And so Black people were once again rendered slaves of the state through the use of racialized vagrancy laws, through mass imprisonment for false debts, and disproportionate sentencing, with the prison serving as an instrument of power to maintain white supremacy as dominion over property. With this, as early as 1960, so before we traditionally think of the later wave of mass incarceration, but as early as 1960, Black men were 5 times more likely to be incarcerated than white men, prior to this era that we, when we're thinking about the new Jim Crow, for example. As a legacy of the 13th Amendment, when a person enters a prison, they are no longer considered a human being, but instead become property of the state. Until 1972, as prisoners, incarcerated individuals actually remained legally dead without clear acknowledgement of constitutional protections until Cruz v. Beto in 1972. And so this is significant because penal institutions successfully transform people into prisoners, right? A person is not a prisoner. Person is not a prisoner without going through a process of social rituals known as prisonization in many literature circles. And so sociologist Irving Goffman, for example, defines how this happens within total institutions, which prisons are a type of. And he describes it as existing within this encompassing and total character that is symbolized by these barriers to social interaction with the outside. And it's also built into the physical plant. So when we're thinking of the space also of penal institutions, we're thinking of locked doors, high walls, barbed wire, cliffs and water. There could be open terrain and so forth. And so his typology, when he talks about the different types of total institutions, nursing homes, actually another epicenter of COVID-19, was a type of institution, total institution for Goffman. But when he talks about prisons, he describes them as being a total institution that's organized to protect the community against what are thought to be intentional dangers to it. And so here, the welfare of the people that are sequestered within this institution is not an immediate issue. And what this means is that it's the punishment function of prisons that is most important. And so this is going to further intensify its totalistic characteristics and its disregard for humanness. And the types of rituals that Goffman and others outline as being important for thinking about degradation as a process and this creating inmates or creating prisoners out of people are things such as replacing people's names with numbers, stripping personal belongings, and replacing them with standard issue clothing so everyone looks the same, giving very minimal supplies, and relegating movement to a way such that incarcerated people have to follow a strict similar schedule, and also requiring that all daily activities are conducted within the confines of a single place. These types of institutions also enforce a strict boundary between prison staff and the incarcerated by training prison staff to see the incarcerated as a lower class of people who require staff to maintain strict control and ensure the incarcerated embody this docile commitment to their degraded status. And so prison staff within this social system are elevated by the institution to a higher moral status as being truly human. And it grants them permission to interact with the incarcerated as an assumed immoral, disrepute, unhuman class. These institutional characteristics, though, officially build violence into the structure of the prison to ensure incarcerated people accept their new status, which I argue instrumentally builds death into the design of the institution. Indoctrination into this status ignites what is known as the pains of imprisonment, or conditions where people are trying to grapple with such high levels of deprivations. These types of social rituals and initiation or the creation of inmates and the creation of the category prisoner are also racialized in a manner that structures the incarcerated experience overwhelmingly from the top down. So for example, scholars who are advancing more critical sociological frameworks on penal institutions argue that it's done in a way that disproportionately harms racial and ethnic minorities. So for example, penal institutions are explicitly racist in their administrative procedures and combine formalized racial and ethnic sorting with risk management protocols. So when people arrive at reception centers, they're presented with a short list of institutional racial categories where staff encourage them to choose one, and depending upon the region of the country. So for example, in California, it's often white, Black, or Hispanic. And sometimes but not always, which creates complications. For example, if you move institutions, sometimes they offer Asian and or Native American, but not always. And so it's important because in this ritual process, prison staff are taking an active role. It's not like people are just choosing based off of their own self-identification. Prison staff are also making suggestions and even policing boundaries and putting people in categories that they feel they should be in. And consequently, this type of classification exposes people to particular types of violence that are on the basis of pre-existing racial and ethnic politics or even community politics, which can have and does have deadly consequences for people by being forced to be sorted into different groups. So why does this all matter? Well, the reason all of this matters is because death by design results in different types of deaths. So what I mean by that is, as sociologists, we are concerned not just with physical death or mortality as an outcome. We're also concerned with what is considered to be social death and what is considered to be psychic death. And the argument here is that the conditions I have laid out are building this into the system before we even have a disaster. And that's important because it dictates how the disaster is going to play out and how it is going to harm people and the level of harm. And the argument here is that it is causing high magnitudes of harm because this is how our institutions are organized from the outset. So the first type of death that I mentioned is social death. So for sociologists, we consider social death to be the dehumanization of a person, which justifies their continual dispossession, their subjugation, and their removal from social society. So social death, it was originally one of the best texts on it, I would argue, is Orlando Patterson's work talking about slavery, for example, as a type of social death. But what social death does is that it permits outsiders the ability to degrade the socially dead as being non-human. And it also influences how those populations that are labeled and treated as such to change how they see themselves because they lose touch with the social world that they were once a part of. And so incarcerated people routinely describe being cut off from the world and the social networks from which they derive a certain type of personhood. Social death also exists on a continuum. with solitary confinement representing how some incarcerated people experience more severe forms of social death. So, for example, all incarcerated people are socially dead, right, on account of their diminished legal status and these initiation rituals by the institution. But when placed in solitary confinement, they are further isolated, even from the social world of the institution. So they are dually socially dead. And so racial and ethnic minorities, importantly, are disproportionately subjected to isolation during incarceration, which is why I will get to the importance of that in a moment, but they're disproportionately subjected to isolation when compared to white people, often under the guise of some sort of security threat group flagging. And they're unduly exposed to severe social death in several states. In addition to social death, psychic death is important as an outcome of these institutional arrangements. And so in regard to confinement, psychic death would be considered the coerced fundamental transformation of cognitive self in an effort to produce a desired behavioral outcome. So the point of that definition is that psychic death is not an accident of incarceration. It is an intention of incarceration. And so for incarcerated people, the desired outcomes by the institution would be docility, deference, and a renewed commitment to a degraded social status. So for example, just to note some work in this area, sociologist Anthony Hatch has done really amazing work on psychic death. And the examples that he draws from is he's done some amazing investigative work to be able to prove that for decades, penal institutions have actually routinely administered psychotropic drugs to keep incarcerated people docile, even if they do not have a medically diagnosed illness that is going to require a prescription. And so the psychotropic drugs that he reveals in his research are things like antidepressants, antipsychotics, sedatives, and tranquilizers. And he was able to pull documentation to show that Congress knew about it at least as early as the 80s, with people writing letters in droves saying, like, this is happening to us. So in addition to the consequences of what Professor Hatch is studying, but also the consequences, as I'm noting, of solitary confinement, which proves very important for COVID-19 as a quarantine mechanism, solitary confinement also causes psychic death. And so it is routinely exposing people to it, because solitary confinement is not a one-off. It's actually a routine institutional practice that then skyrockets exponentially when we have the onset of the pandemic. Finally, when social and psychic death, what they are doing is conferring upon an incarcerated person this status of really being living dead. That is, in the literature, it comes from the literature of necropolitics, but also in interviews I've done with people who have served especially very lengthy sentences, have used that term directly as saying it feels at times like being one of the living dead, being within the institution. But also physical death is another and final way that incarcerated people are subjected to the risk of losing life in the body. And so historically, incarcerated people have had to grapple with institutionally induced physical death at higher rates prior to the arrival of COVID-19, particularly for certain populations. So for example, I have a quote here from the Bureau of Justice Statistics that was published in 2020, really outlining the different parameters of mortality in state and federal prisons to try to illustrate this point. And so what they write is that in 2016, a total of about 4,000 state and federal prisoners died in publicly or privately operated prisons. The number of deaths in state prisons rose 1.3% from 2015 to 2016, while the number of deaths in federal prisons fell 15%. This marked the first decrease in deaths in federal prison since 2012. Each year, though, from 2001 to 2016, an average of 88% of deaths in state prisons were due to natural causes. Over that same span, an average of 11% of deaths in state prisons were due to unnatural causes. And so what's key here is that when talking about natural causes, what we're actually considering are elevated rates of common health conditions that we see on the outside, but that are elevated due to the particular conditions of incarceration. The report also notes that from 2001 to 2016, the proportion of incarcerated people over the age of 55 actually tripled, and that this population has the highest mortality rates. And consequently, this aging incarcerated population was also at a much greater risk for the most serious complications stemming from a positive COVID-19 infection, particularly during the height of the pandemic. In addition to death by design, my second claim as to why prisons are natural epicenters for COVID-19 and how this relates to racism and the history of mass incarceration is the fact of privileging institutional survival versus human survival. So to get into a bit of the history of what I mean by this, many people think that incarcerated people are protected from what I'm describing as institutional death by design as a result of the 8th Amendment on cruel and unusual punishment. However, the legal interpretation of the 8th Amendment has a tumultuous history. So, for example, because of special interest groups, correctional lobbies, and officer unions, Congress passed in 1996 what's called the Prison Litigation Reform Act. And what they were trying to do was halt all of the gains of the prisoners' rights heyday of the 70s and 80s. And so what the PLRA successfully did is drastically reduce the number of lawsuits filed by incarcerated individuals against penal institutions. And it's because the PLRA, it prohibits incarcerated individuals from filing lawsuits alleging institutional abuse unless they have exhausted the administrative remedies of the institution holding them. So that means that they have to follow the institution's own grievance processes before bringing a case to court. And so activists routinely critique this law because it forces incarcerated people to actually request that their abuser change their ways, effectively, creating scenarios where people can face extreme exposure to deaths as retaliation for attempting to try and report penal institutions. And so there's a lot of infamous cases of this that are actually patterned. Some that come to mind right now are, for example, there's cases of people getting to the point of suit, but having their case thrown out because of the PLRA, because it was proven not that the abuse didn't take place. At times, horrendous levels of abuse that are unimaginable, but it's not proving that the abuse didn't take place. It's simply proving that the person was unable to follow the institution's grievance process, which means that they would have to go to officers first and foremost, who are typically the frontline perpetrators of abuse, to file their complaints first before ever bringing the case to court. So this is important because it's also compounded by the fact that city, county, state, and federal correctional associations continue to support this law, and they also continue to support what are considered hands-off approaches to regulating corrections, even during times of great crisis like the pandemic. And so the support for this is framed by these long-held beliefs that deprivation is necessary for control within penal institutions because officers work in enclosed spaces and are outnumbered. But there have been studies, particularly of places such as Rikers, which has shown that even when officers outnumber in terms of ratio, the number of people incarcerated, the abuse is still high. So what this shows instead is that institutional survival is paramount and it is protected by law. Institutional survival also depends on our longstanding bipartisan commitment to prisons as punishment and problem-solving warehouses, rather than an abolitionist vision which would seek alternatives. Prisons are also taken for granted as necessary for the proper functioning of society, and they are intimately tied to histories of Black dispossession, financial enrichment, and white victim restoration. Also, as we've seen historically, when tasked with a social problem, both tough on crime and liberal reformist approaches to punishment jointly produce the outcome of building more penal institutions rather than divesting from them. So as I noted earlier, I first started to tackle this question in May of 2020, really sitting in New Jersey, trying to understand what ties all of these pieces of the puzzle together. And as I was writing and thinking this through, by the time September 2020 came, over 121,000 incarcerated people had tested positive for COVID-19. And so this was representing, in that case, with that data point, a significant 5% increase from just the week prior. So that alone, at the time, I was thinking that, and all of the arguments I have laid out have led me to this conclusion that it is truly about promoting institutional survival rather than prisoner survival. And that's second nature during a disaster because of the pre-existing organization of the institution. And so when disaster is striking, causing severe loss to people and resources, there's a high level of uncertainty. And that is managed by implementing strategies that are going to magnify the deaths of the incarcerated in exchange for this life of the institution. And we also saw this in our work in interview. We did an interview that was actually really telling with the head of the correctional officers union. And the level of uncertainty that he validated from our other data sources was just pretty outstanding, actually. And the level of disregard also in the face of uncertainty for the lives of the incarcerated also stood out as very significant. I want to note as I'm coming to a close that if we think back to that time, I'm bringing us to the point in September 2020. If we think back to that time, if we were reading the New York Times, they were keeping track of the top clusters of COVID-19 in the US. And in September of 2020, which this chart is from, the top 10 clusters in the United States were all within penal institutions. And by that timestamp, over 121,000 incarcerated people had tested positive for COVID-19. And this shows us that COVID-19 became a deadly net widener, and it was intensifying routine exposure to different types of deaths, to social, psychic, and physical deaths among the incarcerated. And this is because emergency management guidelines were implemented in accordance with pre-existing social parameters for corrections and public safety, not for public health. And so the novel coronavirus did not disrupt penal organization per se, but instead the institutional response in line with the existing organization compounded the consequences of the disaster. So a way to think about this as well is that institutions were responding within a given organizational memory that prescribes certain legitimate ways of being, which in this instance in penal institutions, it's punishment and safety and degradation. It is not public health and an attunement to the humanness of the people that are under their care. During the height of the pandemic, as a result, incarcerated populations experienced unprecedented levels of isolation and movement restriction, as opposed to the rapid release of people to create more space. Many people were also afraid to come forward with typical symptoms out of fear of being exposed to severe social and psychic death in the form of prolonged confinement. As of June 2020, Solitary Watch reported that 300,000 people had been placed in solitary confinement, which was an increase of 500%. And so the fears among incarcerated people and their loved ones were understandable and valid, and also empirically verifiable for any that we've encountered in our research that doubted those claims in the interview data. At the very end of 2020, the state of New Jersey finally began releasing people in mass, as I noted, after months and months of advocacy by local groups, many of whom we interviewed, and a few like-minded lawmakers, a few. And so once this release happened, myself and a team of research assistants began interviewing people about their incarceration experience from March 2020 until their recent release. A person who experienced extreme fear of being left behind within cages amidst this disaster told me in an interview that in order to avoid solitary, he and his cellmates would try to care for each other rather than report anything, for fear of being, and I'm quoting, what they called being disappeared, much like what happened to the late Tiffany Mofield. And so he recalled, and I'm quoting, he said, and I quote, "So what guys were doing is we took it amongst each other. Look, if you're feeling sick, don't come out. Stay in your cell. And if you need something, if you need an email sent to your family, give me your password, I'll send it for you. If you need somebody to call your mom, let her know what's going on, give me your PIN number, I'll do it for you. And if you're out of food and you need a jar of peanut butter or a couple of ramen soups, let me know, we'll get them for you. Just stay in your cell for a couple of weeks until you're feeling better or your symptoms are gone or whatever, because nobody wants to go into this condemned wing. So we just handled it amongst ourselves," end quote. So I'm coming to a close, and I want to get to this last interview quote so that we have time for Q&A. And this interview quote that I will end here with was from a community advocate that I interviewed about what she saw and what she noted while she was advocating for incarcerated people during particularly the first height of the pandemic in New Jersey. And she shared, and I'm quoting, she shared, "From the outside looking in, it really looked as if they didn't know what they were doing. And in all fairness, it appeared that no one knew what they were doing. I mean, we all know about the leadership that was not provided nationally. So it kind of left every state to themselves. And the states were certainly not making people in prison a priority. So it was very chaotic, and there was a lot of movement. I really think based on not knowing what to do, the department knew people had to be COVID distant, but there was no way they could adhere to that. We, the state and the Department of Corrections, of course, should have been better prepared, and nobody was. So it was terrible. It was terrible. You would have guys literally hiding on their bunks, end quote. So I'm going to stop there because I see some questions in the Q&A, and I hope I have provided enough for you all to think and converse with and about even after this webinar. So thank you very much for your time.
Thank you so much, Professor Friedman, for that really enlightening talk on your work and your theorizing. We appreciate it so much. I'm going to help you with the Q&A so you don't have to try to read everything while thinking about your answers. We do encourage anyone who has a question to put it in the Q&A box. That's what it's for. And if there's time, Professor Friedman will hopefully get to it. So I think the first question from my guest really, I think this is the theme of a lot of questions. People are really interested in what types of advocacy seems most important to interrupt the brutality that's going on in prison. And this is from one of our guests, Ed Wiltz. Thank you for your comment and question.
Yes, so thank you so much for your comment and question, and I can speak to that, and I can give direct examples for New Jersey, because that was actually key to being able to even get our study off the ground. So what I talked about today, obviously, were my theoretical thoughts and drawing from an article that I published last year on this. But in terms of being able to actually have interviews and speak to people, one of the biggest things that came out of this was our partnership with community advocates, and really shadowing them and seeing what were they doing during this time, because this, I mean, it's so hard to put into words. I mean, we were on the outside, but it's hard to put into words being there when all of this was happening in the tri-state area and working with advocates while the prisons were being hit very hard. And so one thing I will think of an advocate who she has been working in this area. She's really considered she calls herself, these are my words, she calls herself, the thorn in the side of NJDOC. She was one of the main advocates behind the pushing for the bill that ended up with the big release that happened at the end of the year. So what she has been doing for decades, even before the pandemic, is she writes letters, and she would always CC us on them. So we have all of these letters she would write to the commissioner, to the governor, and she's a lawyer. And she does all of her legal work pro bono for clients, bringing cases and writing complaints, and helping them through the institutional grievance procedures to be able to file complaints against DOC. And so through these connections that she had even before the pandemic, that she had a direct line inside to what was going on when she was able to regain contact with people. So for example, she had several JPay messages that she was able to use as evidence when she would get responses from the commissioner at the time, who would say, oh, well, we don't have anything like that happening in the institution. People are able to use masks. And she would just document with the scores of letters that she had. She did her own coding process. And at the time she had a research assistant at Princeton who was helping her code all of these letters. And then she would write her letter and then just list the themes as empirical evidence and say, no, in this institution, you have this many people who have written me for this, or this is the time period. And so she was really pivotal in documenting, and her and a few other attorneys who were doing pro bono work, not with any firm, and then also a colleague of mine at Rutgers, who actually is a constitutional law professor, who also had a number of clients from her previous work. She used to work for the ACLU. And so they were all parts of this coalition in terms of using their previous connections to the inside and their previous work to be able to basically hold up and say, no, these are either lies, or this just misinformation, or this is actually what's happening, and really push in terms of getting it into the hands of a few key lawmakers who wanted change, to be able to get it in front of people with the actual evidence, if you will, that was needed to push to actually show the abuses. And then also, I think by that time, by the end of the year, Governor Murphy, I think, had enough. I know the commissioner, he was eventually sacked. So we have a new commissioner now in New Jersey. But I can speak so much about that experience because they denied our data requests so many times because trying to get more access to what they were doing. So yeah. Thank you for that question.
Let's see. So people are asking, to what extent is this unique to prisons in New Jersey? And I think you did touch a little bit on that in your talk, but it would be nice to hear more perhaps.
Yes, so I would say that it is not unique to prisons in New Jersey in terms of the patterns that I've outlined, and in terms of how penal institutions are organized, and also what makes them epicenters for COVID-19. I think what's particular to New Jersey and also New York City was the location of where we were, right, in terms of the onset. But once you saw COVID-19 spreading more rapidly around the country, the same patterns that I described in terms of the issues facing decision makers about what to do and the impact on incarcerated people were the same. And so there's a number of cases I can think of, but I mean, in terms of public cases, California was in the news for similar reasons. Texas. So these are, to make clear, definitely patterns. But I happened to be in New Jersey at the time and working with advocates and incarcerated people to be able to reveal these patterns. So I'm grateful to them for that.
So someone is asking, who's anonymous here, that they're interested in the in-prison collective action. I know that was such a fascinating point of your talk to me as well, the work that they're doing inside to take care of each other. They're saying that there's more prison strikes and rebellions that we're allowed to know about. Can you say more about the prisoners and how they organized in response to COVID, and what you think maybe the most effective actions look like? To get at a word about in prison and out of prison solidarity, someone's asking, so yeah.
Well, I would say, in terms of, I can definitely speak to other examples or basically what that looked like from the people that we spoke with and also the letters that we have. And so one of the key themes that really emerged on the one hand is that people were trying to survive different types of things. So on the one hand, people are trying to not get COVID-19. People are trying to not be disappeared, was actually used more than once by people from different prisons that were in different prisons. Use that word, which we thought was interesting. So trying to not be disappeared, and then also trying to spread the word when if they thought that their action would be perceived as useful. So for the first one, in terms of trying not to get COVID-19, we have lots of documentation of people telling us of basically thwarting in New Jersey at the beginning, as late as April, they were not letting incarcerated people in many prisons wear masks. They were not letting them. And so people were making their own, and they were making them for other people that couldn't make them or just didn't have the products or anything. It was kind of like a mask drive, if you will, in all of the institutions. People were making them for each other and really caring for each other when the institution was not only not giving it to them, but preventing them and telling them that they couldn't wear. In terms of preventing being disappeared. So we did routinely see people describing not being forthcoming about symptoms, because seeing what would happen to people and that they wouldn't come back. And if they did come back, some people described what they saw, people. And so that looked like not telling officers if someone had symptoms, doing all of the things I described in that quote in terms of providing for the basic care of someone and kind of trying to keep them out of sight if possible. So that really stood out to us as there's so much I can say about that. I would be able to speak about it for a long time, but it stood out so much in terms of just the solidarity that happens when, regardless of all of the different divisions that happen in any prison situation, it's regional, but there are basic divisions you see nationwide. It didn't matter in terms of in the time of crisis. So these are solidarities across racial and ethnic barriers, across religious other barriers that might prevent people from otherwise crossing into that group within the incarcerated class of people. And then finally, what really stood out to us is the fact that for a big part of the early stages of the pandemic, incarcerated people were getting in trouble, or that's what they were describing in the interviews, and also to our direct line through community advocates who were reporting to us weekly, actually, what they were hearing from their clients. People were getting in trouble for trying to file grievances because of COVID conditions, for trying to use the grievance process. But then something changed, and what changed that emerged in the interview data also was that the Correctional Officers Union started pushing really hard against DOC. They got into a beef, if you will, which is interesting, that we have on the record from the union president as well. But they got into arguments about officer safety, and they started not only allowing incarcerated people to file grievances, but encouraging them and telling them, please go file grievances, because it will help us all if everybody's now just sending grievances to DOC. So that is, from a collective action standpoint, fascinating, a fascinating discovery that we came across.
That ties in perfectly with a question someone else had about prison staff, and maybe this is the perfect time for collective action, or to engage people that work in prisons as well. And I think, yeah, you answered that already. I don't know if you want to say more about it, but people are very interested in it from what I'm reading in the chats.
Well, I think that it's to bring in again, critical race scholar Derek Bell, he has a really great argument when he talks about the issue of interest convergence, where he talks about groups that typically would not be on the side of the disadvantaged group will be on their side if it is in their best interest. And that was the first thing I immediately thought when I started hearing this from our different advocate contacts, and then it started showing up in our interview transcripts. I was like, oh, this is so interesting. Like, I didn't realize that we were going to end up studying mobilization, but in this way, but like we are now, that is something that we are definitely going to have to write about. Yeah, right now, actually, I will just say in our first, because it took us a long time. We had a lot of delays with the empirical study, because DOC denied like 2 of our data requests. we there's a new commissioner now, so we are now hopeful that the new commissioner won't shut us down from the outset. And the data requests we were just trying to get basic facility level data. Like it wasn't even anything like onerous. It was just like, no, you can't have facility level deaths by like certain social categories. You're like, why? What are you hiding? But our first work that is going to come out of this study will be looking at the mismatch between public health policies and correctional prerogatives and how that created a lot of tension and issues with staff and DOC, and then showing how incarcerated people really suffered because of the mismatch. So.
Yeah. Oh, they just keep coming in. So someone's asking I think is a great question because it's a very, it's almost asking about sociology. So thank you for your wonderful insights and connections. Will you please say more about intentionality? CRT has been so helpful in illuminating the role of institutionalized systems and bypassing intention by naturalizing dehumanization. What does intention mean when talking about, separated from individual human consciousness? So it would be great if you could answer that question too, as we promote sociology and sociology thinking here.
Yes, definitely. So I think what I like about studying intentionality, I study intentionality in other realms as well outside of studying COVID and prisons, but what I like about studying intentionality is it removes this idea that I do think is very central in sociology of unintended consequences. There's much of our work, I think rightfully so, actually needs to study unintended consequences. But what I'm interested in is actually the design, like how are institutions designed historically, because I'm a historical sociologist as well, and what is the intention at different levels? So first I think of it in terms of the macro level. So thinking of it at, like, for example, the societal level. What are the intentions with regards to race, the distribution of resources across racial groups, and power, and how does power factor? And then how does that seep its way into particular institutions when they make their policies? And then looking at it within the micro level of interactions with people within these institutions, how are they then making decisions with intent that are with intent within a particular system? So I hope that answers the question to some extent, but I in my own work too, I tend to shy away from the idea of, like, for example, being accidentally racist, because even if someone is quote unquote proven to be accidentally racist in their remarks, they still had an intention in their remark that had to do with the evaluation of something, and with one thing being less than and something being better than. And so that is still an intention. And it is debatable. I have debated other sociologists who were more interested in unintentional racism, which I think is fine because I value that work and I use it. But I just think that there is an intention somewhere. And I think that in our particular society, because of the racialized nature of it over scores of historicized periods, it's very difficult to disentangle the intention, even in an era that is considered colorblind. There's still an intention of assigning value on the basis of race. I hope that answers your question.
It's wonderful. Someone is asking, they're saying it's a fine line to walk, and this sort of sounds like process of your own process. It's a fine line to walk to have and keep access to the institution and the folks inside, and to simultaneously advocate for the change. Did you feel that that was a tension in your research? Or
yes, I'm sorry, Emily.
Oh, no, go ahead.
It definitely was attention, and I think it was also recognized. For example, I think that's why NJDOC denied our request, because they knew that we were interviewing community advocates that were, at the time, were causing them a great amount of trouble, a lot of trouble, actually, the whole year of 2020. I say this because I do know of another research team that was approaching the study from a different orientation, did not include community advocates, and wanted to more so, basically, in terms of their work was previously on like correctional policies in terms of making corrections better, versus our work was not necessarily, it was just, our work was more about questioning, like, should corrections exist, which is a valid question. And if they had a valid answer, they wouldn't have been threatened by the question, is how we felt about it, our project. And I think that political line was very strong, because all research is political. How you choose your question is political. How you design your study. And because our study was designed in a way that was trying to understand what was actually going on versus not shying away from if the DOC was going to look bad, then we were fine with that decision, and being, labeled as such as not someone that they would want to just give data over to, that we'd actually had to fight to get something.
Yeah. Let's see. Someone is interested in whether or not the wake of COVID is transferable to other types of disasters. So earthquakes or floods. I think you said it was a natural epicenter, so maybe that's where this question is stemming from.
Well, I think that a lot of the thoughts that I've outlined in theorizing definitely are. I think that if we look at other disasters and we look at particular types of institutions that are actually tasked with having people under their care, and we look at their decision-making processes in the wake of a disaster like an earthquake or a hurricane, who do their decisions benefit? Do they, and who don't they benefit? Who gets left out? And does this decision-making process of who gets left out, which traditionally are people who are poor, working class, Black communities, Indigenous communities, if they're getting left out so that the institution can make decisions to only serve a certain few and also to save itself, I think that it is a pattern. And I think that we should question, in the wake of disasters, how are institutions making decisions? Are they making decisions that are benefiting them more so than the communities that they should be serving? And I think that it's a bold question, but I think it's fruitful. I think all bold questions usually are more fruitful than shy ones. Definitely.
Someone is asking about a Supreme Court case guaranteeing medical rights to prisoners. Is this something you're familiar with? I'm sure. Were lawyers able to assert claims to care for prisoners, or did COVID break with standards of care?
So I think that, as I've shown, COVID definitely broke with standards of care. And so to the colleagues that I mentioned, at least in New Jersey, I did get a little bit of an inside view into their work with clients. And particularly in the year 2020, their arguments were not very successful in getting DOC to move, and also getting DOC to be held legally accountable for its irreprehensible conditions. And I think it's because of the way that I outlined is that ultimately, politically, the hands-off approach in terms of corrections is bipartisan. And this idea that they are doing us a societal service by protecting us from the worst of the worst, that they have a really hard job, so we have to give them leeway. Like, that argument is, I think it resonates with many, even many who would be more progressive in terms of that they would need the leeway to be able to make decisions. But at least what we saw in our research, and I will say in that interview with the union president actually said himself that administrators were closing the door on his staff, which has angered the union because they weren't just closing the door on grievances by incarcerated people. The administrators at times would not come out of their office to even hear what staff were saying because of having so much the chaos and the uncertainty, and I would imagine the stress of the pandemic.
Wow. Well, I think we only asked you for 30 minutes of questions, and I think we've gotten a lot. Would you mind ending with telling us what your next steps are in your research? That's something people are interested in as well. We just love to hear more about what you plan to do next, so we can keep up to date.
Yeah, thank you. That's really kind of everyone. I appreciate that. Well, I can say particularly to this study. So for this project, as I was noting, our current working paper is we're trying to kind of tease out these tensions that happened at the administrator level, but within institutions for staff who were trying to deal with the public health issue, but also within a correctional framework. So there's that work. And then also I'm working with a research assistant who's amazing. She did a lot of interviews and is just brilliant. Her name's Allegra. And Allegra and I have started also parsing out from our data set a paper really showing, in the words of incarcerated people, how the pains of imprisonment and deprivations that I described in my talk that are common to prisons, how they changed. And in our data shows they were worsened because of COVID-19. So those are the two projects that we're working on right now. And then also we are still going after certain types of data. We had wonderful colleagues at COVID Prison Project, gave us some really amazing data. I would love to actually put that in the chat if that would be helpful for people. If they don't know of that program, that project, the COVID Prison Project is amazing in terms of they've been keeping track since the start of the pandemic. And they were very generous to give us access to data for New Jersey when our requests were initially denied. And so that's another next step, is we are still working on filling in some of the gaps in their data to be able to show quantitatively different trends to match our qualitative data.
Well, thank you so much. I'm not alone in thinking this was such a wonderful talk to hear. I feel like I learned a lot, not just, I think I before may have seen prisons as, everyone's close together and that's why COVID is spreading, but you have shed so much light onto this situation, and providing this resource is great for people as well. So thank you so much for your time. The Sociology Department really appreciates you kicking off the Robert Liebman Lecture series that we hope to do every year, and we look forward to reading all of your work as you move forward. You're an assistant professor, so it's exciting to get to follow you.
Thank you so much, Emily. Thank you so much, Lindsay. Thank you, Matt. I am just very grateful to be here and to share the work, and I really appreciate the level of engagement and the questions, and it's very exciting that people are really interested in these issues. So thank you.
Thank you.
So thanks so much, everyone, for being with us tonight. Thanks, Emily, for filling in the questions, and thanks so much, Brittany, for being with us. So yeah, again, I hope you learned something, and I hope you carry some of this with you into conversations that you have going forward. So thanks again, everyone.